welcome to the Channel 2 News Hour, where today we'll be talking about a very serious mental disorder called schizophrenia that affects over 1.5 million people worldwide. Now, schizophrenia is a disorder that causes extreme auditory hallucinations within the victim and also causes severe paranoia whenever in any social situation, be it with friends or with a complete stranger. Now, the psychotherapeutic options for schizophrenia are basically centered on one thing, which is to help the victim overcome their paranoia and their hallucinations that they have. Now, the psychosocial options are primarily focused on the paranoia and how to better talk to people and know that not everyone is against them, while the psychotherapeutic is more on the hallucinations and knowing when they're having a break from reality and how to overcome these hallucinations. And with the help from a strict medicine regimen and a lot of hard work, this can help the victims overcome their disorder and have a better social life and a better life in general. And they won't have to worry about being paranoid or having to hear things that aren't real. And today we have Dr. Emma, who's from a psychologist research lab that's trying to find out the best way to treat schizophrenia. And she's going to be talking about the main ways that we can help treat schizophrenia through psychotherapeutic options.
Thank you, Nathan, for that introduction. As he said, I'm Dr. Emma, and I have been studying schizophrenia for the past 5 years. So one of the major treatment orientations used in schizophrenia therapy is CBT, or cognitive behavioral therapy. This has eventually come to be used as a promising treatment for individuals with schizophrenia that are not controlled or rely on medication. During CBT, the individual will examine evidence for and against the distressing belief. The distressing belief meaning any symptoms of schizophrenia. They will then challenge habitual patterns of thinking about the belief and then use reasoning and personal experience to develop rational and acceptable alternative explanations and interpretations for coping, problem solving, and self-managing of the illness and its symptoms. I hope this helped. Back to you, Nathan.
Thank you, Dr. Emma. Now I'm going to try to differentiate all these types of therapy into two different categories, individual and group. Now, individual will be one-on-one with the psychologist that would help you understand how to control these hallucinations and the paranoia with a strict regimen of medicine and behavioral therapy that would help you understand how to better control yourself in social situations. Where in a group setting, you would be in a self-help group where you'd be able to better understand your mental condition and how to better prepare yourself and reintegrate yourself into society. Now, Dr. Emma is going to talk to us just how effective are these treatments in helping the victims of schizophrenia reintegrate themselves into life.
Thank you, Nathan. The treatment of schizophrenia is usually lifelong and often involves a combination of medication, psychotherapy, and coordinated specialty care services. One common type of medication is anti-tremor medication, such as benzotropine, which can help control tremors, shaking, and unsteadiness, which is common in schizophrenic individuals. Also, antipsychotic medications such as chlorpromazine and flufenza can reduce or improve the symptoms of schizophrenia. Unfortunately, by taking these medications, the symptoms of schizophrenia is not guaranteed to stop, but you will be able to control the symptoms easier. I hope this helps.
Thank you, Emma. Now, I'm going to try to talk about two social reasons why schizophrenia patients would not seek treatment or try to terminate it early. So there's cultural and ethnical reasons for this, where many cultural groups actually perceive it as weak to seek any type of treatment when you have a mental disorder. And some religions don't even let their believers take any medicine at all for any type of problems. So as you can see, even a person who has schizophrenia would still have reasons not to seek any treatment, and it can lead to them having a terrible life. So Dr. Emma is going to try to tell us how exactly can we build better prevention skills so that we don't face problems like this.
Thank you, Nathan. So some great prevention strategies that build resilience is having a positive outlook on your life and never doubting or having negative thoughts towards yourself. You also need to talk to anyone and never be afraid to speak about your disorder, because there are people just like you out there, and there are therapists that can help and will help you. Also, talking to your family and friends and getting the support that they will give is always extremely helpful when going through and figuring out what type of medication and therapy is best for you. I hope you learned more about schizophrenia today. This is Channel 2 News. Thank you for watching.